Hi, I'm Amanda Olson, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist for IntimateRose.com. And today I'm going to talk about how to progress from one dilator to the next. So, for example, if you're using dilator number 6 and finding that it's become easier, but you can't quite yet move on to number 7, there are a couple of different trainings that you can do in order to prepare to better move on to the next dilator to reach your goals. So, for example, if you can insert a dilator into the vaginal canal without pain, but you're not ready to move on, one thing that you can do, so picturing that this is the vaginal opening and you're going to carefully insert the dilator, is that you can imagine a clock around the vaginal opening where 12 o'clock is up top and 6 o'clock is down below. And you're going to, with the dilator inserted into the vagina, gently compress the dilator up into 12 o'clock and hold for 1 or 2 minutes and then relax. And then gently compress into the vaginal wall at 1 o'clock and then relax. And then so on and so forth, moving to 2 o'clock, 3 o'clock, all the way around the vaginal opening. And that is just going to help get some better extensibility in through the vaginal canal. It'll help train the muscles to be able to relax and tolerate some compression. And that way you can better move forward with moving on to the next dilator. You can also try changing positions. So a lot of times when you're practicing with your dilators, maybe you are lying down. One thing that you can do is go onto your hands and knees and work with the dilator in that quadruped position. It is going to change the relationship of the pelvic floor against gravity, so it's going to feel different. But that can be one way to help desensitize the nervous system and help relax the pelvic floor so you can better be able to tolerate having sex or a tampon or having a medical exam. And likewise, you can also try sitting on the dilator. I always recommend you insert it first in side lying position, so lying on your side, and then carefully sit up. So then the dilator is inserted and you're sitting on it. It is going to feel different, but that's another way to get just a little bit of a different training or mobilization of that vaginal tissue in order to be able to better progress to the next dilator. For more information, you can visit our website at IntimateRose.com or email support@IntimateRose.com.